Welcome on behalf of NC Child and the North Carolina Institute of Medicine, and thank you for joining us. We're so glad you could join us to learn about this year's statewide Child Health Report Card and how you can use it. Before we get started, I have some quick housekeeping and instructions for everyone. This session is completely bilingual in English and Spanish. We have a live interpreter on the line. To choose a channel, look for the little icon of a globe and the word interpretation on the bottom right side of your Zoom screen. Click that globe icon and choose either Spanish or English. To ask a question at any time during the presentation, type your question in the Q&A box at the bottom of your screen. You can use the chat box for general questions. I'm Erica Palmer-Smith, Executive Director of NC Child. We are a nonpartisan nonprofit dedicated to advancing public policies that ensure that every child in North Carolina has the opportunity to thrive, whatever their race, ethnicity, or place of birth. Our partners at the North Carolina Institute of Medicine seek constructive solutions to statewide problems that impede the improvement of health and efficient and effective delivery of health care for all North Carolina citizens. They serve in an advisory function to state government. The Child Health Report Card was first established in 1997 with the goal of identifying areas in children's health for improvement and policy change, as well as celebrating bright spots in our state where kids, families, and those serving them are doing well. The report card also allows us to acknowledge the tremendous efforts of healthcare providers, state and local public health advocates, and others working for children and families. It helps foster connections across the state between all those working to ensure that North Carolina kids are safe and well. The report card is issued every 2 years. We'll put the link to this year's report card and related resources in the chat. Joining me today are Luna Homsey, Health Policy Analyst for NC Child, and Christian Curry, Project Director at the North Carolina Institute of Medicine. Christian, I'll turn it over to you to get us started.
Thank you for the introduction, Erica. Can everyone hear me okay? Okay, sounds good. So we'll be going over the grades and a few data highlights from the report. The Child Health Report Card includes data that measures the health and well-being in children. They indicate and point to how kids are doing in our state. These data measures fall into 4 broad categories: secure homes and neighborhoods, access to care, healthy births, and health risk factors. We also publish demographic data with the report and highlight data related to a special topic. This year, we chose children's mental health as our focus area for the special topic because, as many of us know, even before the COVID-19 emergency and school closures, kids have been in crisis. There have been concerning trends in suicidality in youth across the country and in our state. That crisis is exacerbated by factors like lacking access to health care, food insecurity, or family economic insecurity. So it's deeply linked to many of the indicators that we have historically tracked in the Child Health Report Card. The North Carolina Child Health Report Card, in the report card, grades are assigned by a panel of health experts from across the state. Grades are subjective measures of how children in North Carolina are faring in a particular area and are not meant to judge the performance of a state agency or agencies providing data or services. There may be circumstances in which the progress achieved by specific agencies throughout the state may not be fully reflected in the grades assigned to the health indicators in the report. Grades and trends are based on North Carolina's performance year to year, disparities by race and ethnicity, and what level of child health and safety North Carolina should aspire to. When considering grades for health indicators, the grading committee may use the following criteria to inform grade assignments based on improvement or decline in a particular area. So they look at trend analysis. Are outcomes and indicators improving, stabilizing, or getting worse? What variability is there between outcomes between different demographic groups, and how do they assess disparities? They consider how the data compares to North Carolina's overall health goals. So based on their knowledge and understanding of our state's goals for improving child health, are the outcomes and indicators on track to meet those goals? And then finally, the committee also considers how our data looks in comparison to national averages and data-driven national objectives. So based on their knowledge and understanding of how the nation performs, are North Carolina's outcomes better than, the same as, or worse than the national average? And how aligned are our outcomes with national objectives to improve child health? So those are just some of the things that the grading committee considers when assigning grades. And now I'll hand it off to Luna to kick off a review of the grades in each area of the report.
Thank you, Christian. The environment where children live, learn, and play has a huge influence on their health. And the grading committee gave the following grades: an F to housing and economic security, a B to environmental health, and a D to child abuse and neglect. These grades tell us a lot needs to change to help kids thrive at home and in their communities. In North Carolina, 40% of children live in poor or low-income households. Families living on low incomes have a hard time covering the basics, let alone paying extra fees for enrichment activities like sports or after-school programs. In many low-income communities, families have a much harder time finding safe housing, healthy food, and safe public parks where they can play and exercise. This graph of the rate of deaths broken down by type in the state is very staggering. While deaths caused by motor vehicles and other unintentional injuries have dropped since 2018, the rate of children's death by homicide is pretty stable, and the deaths by suicide and deaths by firearms have increased. As you might have guessed, these numbers relate directly to our special topic on children's mental health in the state. And whether a family can get affordable healthcare has a huge influence on their children's health and well-being. The grading committee gave these sections the following grades: a C for oral health, F for school health, B for health services utilization and immunization, and A for insurance coverage. I'd like to highlight that A especially. We saw an improvement in health coverage for parents. The Families First Coronavirus Response Act of 2020 required states to keep people continuously enrolled in Medicaid in exchange for enhanced federal matching funds through the end of the COVID-19 public health emergency. That requirement ended as of April 1st. And it's a part of why we saw the number of North Carolina parents without health insurance decrease from 15% in 2019 to 13.9% in 2021. We look forward to Medicaid expansion, lowering the number of uninsured parents even further, and we're so grateful to our state's leaders for recognizing the importance of health coverage. Christian will now talk about healthy births and health risk factors.
So we track indicators related to preconception and early childhood wellness. The grading committee gave these sections the following grades: a C for breastfeeding, B for preconception and maternal health and support, F for birth outcomes, and a C for teen births. The bright spot in this section is for the B in preconception and maternal health and support. About 87% of women between the ages of 18 and 44 have health insurance, and a little under 75% of pregnant women received prenatal care. Like with all the indicators that we track, we see a lot of disparities within these numbers. This graph shows us the changes in the percent of women aged 18 to 44 who have coverage. The blue dot is the percentage in 2010, and the orange is 2021. A bigger percentage of women from all backgrounds now have coverage, but it is clear that many women face barriers to health coverage. We see the largest disparities when we compare the rates of Latina and Hispanic women and American Indian women with insurance to the rates of white and African American women who have insurance. The health risk factors sections looks at indicators with a wide lens. In this section, indicators for healthy eating and active living, tobacco, alcohol, and substance use, and education all receive Ds. Mental health received an F. The committee moved the grade for tobacco, alcohol, and substance use up to a D this year as opposed to the F that it was assigned in 2021. The percentage of high schoolers who reported currently using vapes, cigarettes, or alcohol, or have ever used prescription drugs without a doctor's supervision has decreased significantly. So that's heading in the right direction, although we still have room for improvement. So education creates opportunities for better health, including higher wages and greater access to resources like nutritious food and regular exercise. The percentage of students reading at grade level has declined across all ethnic and racial groups, with dramatic disparities for Black, Native American, and Latino children. Last school year, only 46.4% of third graders read at grade level. We also saw a dramatic change in mental health indicators. More than 1 in 5 high schoolers in the state report that they have seriously considered attempting suicide. I'll pass it to Luna so she can give us a little bit more information on our special topic focused on mental health.
Yeah, the data on children's mental health is extremely concerning, unsurprising to all of you listeners. This crisis is deeply linked to many of the indicators we've historically tracked, as Christian mentioned. And even before COVID happened, we were facing a crisis. Factors like access to healthcare, food insecurity, economic security make this worse. And I'd like to remind people that if they or people they care about are in crisis, they can dial 988 to get support from the Suicide Prevention Lifeline. In 2019, as it says on the slide, suicide became the leading cause of death for children 10 to 14 in 2019. The percentage of high schoolers considering suicide has gone up since 2017, as has the number of students who reported making an attempt. And homicide and suicide are the only causes of death that are increasing in our state. The child deaths involving firearms rose more than 40% since the last time we published the report card. There are solutions, however. In 2021, some healthcare providers and professional organizations published a statement on the National Emergency in Child and Adolescent Mental Health. And they gave a number of recommendations, including reducing barriers to care, improving availability of mental health care, and getting kids care where they are, like in public schools, especially in rural areas with limited access to specialty healthcare, and making it harder for children and youth to get their hands on deadly means that lead to these sobering statistics. We're so grateful for the parents and elected leaders and clinicians who are coming together to reverse this crisis and bring our kids back to health. Provisions in the State House budget and other proposed legislation would help kids access care where they are every day at school. And I'll pass it back to Christian to walk us through some more of the disparities we see in the data. Oh, you're muted, Christian.
Sorry, can you hear me now? Great. The data in the report highlights several disparities that we want to call attention to. So as you can see, Black and Hispanic or Latinx children are more likely to live in poor or low-income household. Hispanic children are most likely to attempt suicide when compared to Black and white children. And then lastly, Black and Hispanic or Latinx children are less likely to read at grade level. Racial disparities and infant mortality rates continue to persist. The rate of Black infants who die before their first birthday is over 2 times higher than the rate of white and Latino babies. I'll hand it back to you, Luna.
Yeah, so the data laid out in this report, along with the grades from the grading committee, can serve as an important jumping off point for essential work in our state. In the case of service providers working directly with kids, these statistics provide more context for the challenges facing families and children in our state. We also recommend using the data as a way to identify focus areas for nonprofits doing programmatic or policy work. NC Child uses data to help guide our policy priorities. So, it works. And if you're a parent advocate, this data can be a tool when you're talking with friends and community members about the things that matter to you. If your community is debating whether or not to put in a new grocery store, you can use this data to show why kids need accessible, healthy food to grow, or the lack of access also in your community. And if your school doesn't have a counselor, you can use this to show why funding mental health providers is so important. You can find the complete report the data sources and a social media toolkit on our website at ncchild.org under the Data tab. On there, you can also find a link to the archive of child health report cards going back to 1997. That'll take you to the NCIOM website. And you can reach out to Christian and me via email and stay in the loop with NCIOM and NC Child on social media. If you found the data included in the Child Health Report Card useful to your work or advocacy, please consider supporting us by making a gift to NC Child or NCIOM. Your support keeps our collaboration going and allows us to work together to continue tracking child health and well-being in North Carolina. Thank you for joining us today.
Thank you, Luna. We will get started with some Q&A this afternoon, I guess now. So to get us started, I see a couple of folks have already put some questions in the chat. The first one is from an anonymous attendee, and the question is, how did you determine the metrics and data sources that you used to evaluate each component of the scores? Were each vetted on validity and statistical significance?
That's a really great question. So like Christian mentioned at the beginning, we have 4 broad categories. So I think that was the origin, and many of our sources are local government agencies or federal state agencies. So we are relying on the legitimacy and importance of the work that they do. But we are reporting the data as given to us by the agencies and not conducting statistical analysis. Did I cover that? Christian, do you have anything else to add?
I think you covered that beautifully, Luna.
Thank you. The next question that we've got in the chat is from Christina. With preconception and maternal health support receiving a B, what are the thoughts about the correlation between low birth outcomes?
So, sorry, I'm ready today. What comes to mind for me is that coverage is not the same as care, right? We are celebrating improved coverage, but that does not always translate to availability of providers, of consistency of care, of all of these other aspects. So there's still a long way to go, and the disparities in birth outcomes are proof of that.
Thank you, Luna. And then our next question is from Kimberly, who says, thank you for an excellent presentation. Thank you, Luna and Christian, for an excellent presentation. But also, does the full report card include data on LGBTQ youth?
We don't have any specific data highlighting those disparities, but there are studies that show that kids who experience discrimination are more likely to deal with mental health challenges. And so those disparities exist, but we haven't pulled them out specifically within the report.
So that is the last of the questions. Oh, no, we have some more. All right. So the next question is, has every North Carolina and U.S. congressional senator and representative received this report card? And that is from Dr. Kathleen Clark Pearson.
That's a great question.
I'm happy to answer that one for you, Luna.
Yeah.
Like, the answer is not yet, but we are in the process of ensuring that happens. And we're trying to do so in a way that makes sure that this report card gets noticed. So this is not something that we're going to be talking about just now when we do this release. This is something that we're going to be talking with our legislators and representatives about for the coming months. And working to make sure that we're able to advance policies that are going to bring our ratings up in many of those areas. So our next one is an anonymous attendee, and it is, what is defined as early prenatal care?
I'm trying to pull up the exact definition, Luna. I don't know if you remember it from the top of your head.
I believe it's care within the first or second trimester But I can also pull up the data, the data sources that also include those descriptions of the indicators. And I'm so sorry that I was speaking so fast earlier. I could not see the chat, so I'm very sorry.
All right, so our next question is from Martin. Do any of your agencies that provide data track how many youth are caregivers within their family for grandparent, parent, and or siblings?
That is not something that we include, but that is such an interesting and important piece of a measure and an indicator to pull out. And I think that that is something we're open to. So if you have a data source that you'd like to send our way and say this is something that is available, we definitely consider it. But I'm not sure if it's currently available in the agencies that we work with.
Thank you, Luna. And so this next question, I'm going to pass it to Christian and Luna first, but I'm happy to help answer it as well. From Kimberly, have you considered timing the sharing of this report card earlier in the evolution of a legislative session? I ask, given that today, very correctly, is crossover. I'm happy to help with that if you ladies. Okay, so I think the best way to answer that is if I was able to create from scratch the timing of everything, we would absolutely be introducing this in the fall before a long legislative session. But because of the process that goes into this, and again, this is an every 2 year project. That would not have been possible this year. But I think that that type of feedback is extremely helpful because, those are conversations that we're having now about what we're doing, looking at the next report card that we're going to release in a couple of years. We are hindered by a lot of the when certain data is accessible for us to be able to have a comprehensive report. But that is very well noted and is already definitely a part of the conversation about how we move forward in the future. One note that I'll make for folks is that we'll be releasing our county data cards this summer that are going to look at a lot of different factors impacting children, the number of children in poverty, the number of children, again, with health access, et cetera, by county later this year. And we are intentionally timing that to take place in the late summer and early fall to allow for conversations to happen with legislators prior to the next time that they're in the chambers. So I will note that about those county data cards. The next question I'm gonna actually sort of answer along those same lines. Dr. Clark-Pearson, again, I think it would be important for a local constituent to send the report card to his or her representatives. For example, I can get the report card to my Ashe County Senator and Representative. Dr. Clark-Pearson, we would love for you to do that. And that is something, again, that we are hoping that over the next number of months that NC Child is going to be working with a lot of our Child Advocacy Network members and others to make sure that this information gets to those legislators. And in my ideal world, they're not getting it just from one person. They're getting it from a local constituent, a local organization, from NC Child and our staff. And so that is this work is going to continue for many months after this initial release period has passed. The next is from an anonymous attendee. Do you know of a resource to compare these data points to other states? Or do either of you know how we are comparing to other states?
That's a great question. We have another resource linked on the NC Child website, which is the Kids Count Data Center. There are a total of 50 indicators, North Carolina specific, but you can select things of interest and then compare how we compare our performance with the state of interest. So And then I'll pass it to Christian to talk a little bit about the grading committee and the things that they use in order to assign the grades.
Yeah, so the grading committee considers things like obviously, like I mentioned, trend analysis, but also thinking about the health objectives of the state as a whole. They draw on their professional background and knowledge to think about how North Carolina is positioned both nationally and in comparison to other states. So those are just some of the things that they kind of access in assigning grades.
Yeah, so we take it into consideration with the grades that are applied, but that is my recommendation as a resource, the Kids Count Data Center.
Thank you. So the next question is from Terry. What data was used to determine that 1 in 5 high school students seriously considered attempting suicide?
That's from the Youth Risk Behavior Survey in North Carolina Public Schools.
Thank you. The next is from an anonymous attendee. When this report is shared with policymakers, will it be accompanied by a companion support guide or policy considerations? Would you like me to take that one?
That'd be great.
So that's a complicated answer. So it's a yes and a no. So the no is that it is not attached to a comprehensive list of policies that will comprehensively address each of the areas in which we are not doing well. What it will be accompanied with oftentimes are specific policy recommendations that we are working on right now in this legislative session. So that is for right now. So for example, our policy director who's on here, but I don't know if she has the ability to speak on the panel, Tiffany Gladney, is actively having conversations around much of the mental health legislation that is in play right now at the legislature, and talking about appropriations for school-based mental health support by also talking about this child health report card and the youth mental health data that we see on it. And so that is something we'll continue. What we'll also again continue to do over the next couple of years is ensure that we are having continuous, not one time, but continuous conversations with legislators about the state of children's health in North Carolina and what those big picture policies are that we can do to really make some impact. The next question is from Martin. Yes, I have been trying to get this included in North Carolina's Youth Risk Behavior Survey for North Carolina Public Schools, which the CDC included in the last Florida YRBS. Let's discuss ways to collaborate. All right, Martin, let's do it. I am co-chair for the National Advisory Council for the American Association of Caregiving Youth, and I am based in North Carolina. Martin, I hope that you are okay with this. We are getting your name and we will be reaching out. Thank you so much. Our next question is from LaQuisha. Not a question, however, I want to comment. These data cards are very useful. I'm grateful you all have these. Thank you. Thank you. And I do want to take a moment to say thank you again to Luna and Christian for the incredible job that they do leading this project. The next is from Mariah. Is there any way to track maternal deaths along with infant mortality within this report?
I definitely,
go ahead.
I think that's not something we've historically done. I think in this report, the data is mostly focused on child health outcomes. However, I think that's an excellent point and something we could consider in the future. Sorry to interrupt, Luna.
No, yeah, exactly.
So our next question is from Lisa. Any idea what the highest score on mental health has been in the past and what year that would be?
That is such a great question, and I don't know the answer to it. So I will look into it, and I think that's something we could definitely do a better job of communicating the historic changes in grades so we can see progress over time.
Thank you. I think that is something we will definitely be following up on, because I think that is actually something that would be a really good talking point as we're trying to move some of the legislation forward. So we will make sure to get that information. The next question is from Morgan. What other ideas would you give us as constituents for how to best utilize this information?
Yeah, great question. As I said, this can be a jumping off point for conversations for personal interests, because you might really be passionate about affordable and healthy food. So getting to look at how many kids are living in food insecure homes can help spark the rest of your advocacy journey. And yeah, I'll pass it along to the rest of the panelists if they have any ideas, further ideas.
Well, I will say, many of you may oftentimes see some alerts in your email inbox, and you may wonder what you can do to try to help move some of these issues along. And I would really encourage you to take action whenever you see those opportunities come across. And again, we're going to be reaching out to folks in our Child Advocacy Network in the coming months to really continue to press this information forward. And so helping us to get that education in place, it's really critical that our policy decision makers have access to this kind of information for them to be able to make good decisions in their seats. And so we would ask that all of you try to be as helpful as possible and responsive whenever those opportunities arise, and we will be reaching out. The next question is from an anonymous attendee. How do you anticipate Medicaid expansion impacting this work or these results? And I'll pass it first to Luna and Christian, but I'm also happy to dive in here as well.
Yeah, I'd love to hear your answer, Erica. As Medicaid expansion fiend, I don't know. Yeah.
Sure. So we know that Medicaid expansion in the 40 other states that have implemented, we know that Medicaid expansion has made incredible impacts for children across a range of areas from birth on. We know that whenever we have Medicaid expansion in a state, that we see lower maternal mortality rates, we see lower infant mortality rates. And here's the key, particularly among Black infants. So you saw that we have 12.8 Black infant deaths for every 1,000 births. We see in states that have expanded, not just a decrease in the overall numbers, but significant decreases in those disparities. We also know that when we have a Medicaid expansion in a state, we see children get better access to healthcare. First of all, we have the welcome mat approach, where kids who are not currently covered by health insurance are more likely to be covered because their parents are. We also know that even whether they're covered or not, that they're more likely to actually go to those well child visits to get preventative healthcare that they need so that they have healthier outcomes as kids. And where you saw that North Carolina has a D in child abuse and neglect, we know that in states that expanded Medicaid, they have a 17% reduction in first-time neglect cases because families are able to get the supports that they need to take care of their kids. I got excited, so I'm going back to the Q&A. The next one is from Kimberly. Considering the impact of policy or lack thereof is important when considering the impact of policy or lack of is important when evaluating performance.
Yeah, I take that as a comment on including that in our evaluation criteria, and we'll take it into consideration. It definitely is a part of the landscape that these outcomes exist in. So thank you, Kimberly.
The next question is from Beth. Have you considered including homelessness, McKinney-Vento data in this report?
I don't know that we've talked about that. I think this is the first time that we're considering it. I think that's really important. And thank you for bringing that up.
So our next question is from Dr. Clark Pearson. Should we have a child advocacy report card day at the North Carolina State Legislature? Not everyone could physically attend, but our network advocacy folks could all get an action alert email announcing this special day and be encouraged to get their report card to their legislators. Dr. Clark Pearson, I think that is a fantastic idea. Referencing back to some of the earlier comments and questions, as you all know, we are in May. It is crossover day. And so the ability to sort of from where we are do that this year becomes a lot more difficult. We can and will be doing a lot more in terms of online, trying to make sure that folks are sending that in. And then again, after this session, really preparing for 2024 by making sure that this report card is in legislators' hands from multiple sources. I think that in future years, one of the things that we're going to be talking a lot about is how do we best use our advocacy network to make sure that these things are shared. And I think a child advocacy report card day, we haven't called it, we've talked about child advocacy days. We haven't talked about a child advocacy report card day. And that's a really, really great idea that we're going to be looking at in the future. And the next one is from Yun. As a follow-up to the Medicaid expansion question, do you have targeted recommendations on how to deploy the $1 billion allocated for mental health by Governor Cooper? Would you like me to take that?
Most of what I want to say is just that this card, while such an important advocacy tool, is part of just reporting the current state of things. So we don't do policy recommendations within the report, and we hope that all of the people, the constituents and community members use it, but that's the only comment, and I'll pass it back to you, Erica, if you'd like to respond.
Thank you, Luna. And I will take a minute and just say, I think part of the way that we do the report card is to separate it from the legislative process. So we want to make sure that we have good information for the sake of having really good educational information. And then NC Child, of course, we use that to talk about to determine what policies are needed. And I will talk a little slower. So we use that to talk about what policies are needed and then to educate legislators around where we are and how those policies could help. But I do think that there is tremendous value in ensuring that this information, that this educational resource that we've been able to offer for, I think, 26 years now, that we make sure that it is sort of free from where we are in the legislature, free from specific policies. This is the information, and then we go and we use it for policy purposes. The second thing that I'll add to that, so the $1 billion proposal from Governor Cooper, so that I'll note that was not in the House budget. And so it's sort of yet to be seen whether we're going to see that in a final budget. There was last week a bill filed, excuse me, by Representative Donnie Lambeth and 48 co-sponsors that would also provide $1 billion to improve our state's mental health system with some specific allocations. That bill has been filed or has been referred to the Health Committee. Again, it's sort of yet to be seen whether that's going to move forward. And I believe that is it for our questions. I'll give folks just a moment to see if anyone has anything to add, and then I will pass it back over to Luna and Christian. We got to thank you.
Thank you all for joining. If you have any further thoughts or questions, I'll speak for myself. My email is luna@ncchild.org. We're very interested in talking about data and how you're using it and any questions that you have. And yeah, again, thanks for joining.
Thank you all so very much. We hope you have a wonderful rest of your Thursday. And please reach out to your legislators. Please share this with anyone that you can. And please let us know if you have any questions after today.